Recording in progress.
Hello, everyone. Thanks for joining us on the media briefing on this Wednesday. We're going to get started with our discussion on vaccine for children ages 5 to 11. It's, of course, been in the news, and we're seeing a lot of movement towards getting children that age vaccinated. So we're very pleased to have Dr. Martha Blum from Community Hospital of the Monterey Peninsula and Dr. Mahendra Pudel from Salinas Valley Memorial Healthcare Systems to join us to talk about, what is ahead for vaccine for children. Good afternoon, doctors.
Afternoon.
Okay, good. I've got you. I'm really pleased that you could both be on to talk about vaccine. Vaccines are really just around the corner for children in California, and parents still have a lot of questions. Who would like to go first today to talk about vaccine?
I'll start and just talk a little bit about the safety and efficacy and some of the expected possible reactions or side effects that we saw in this younger age group. So as many of you have already heard, it's gone through many levels of certifications and verifications, and a lot of scientists have reviewed the data that came out of Pfizer when they studied the same vaccine preparation in children ages 5 to 11. The only modification that they made to the vaccine was the dose. So these younger children are receiving 1/3 the dose that everyone else ages 12 and up got. They studied over 2,200 children. And the good news is that they actually saw fewer adverse reactions and side effects than they saw in their larger trials of older children and adults. So your kids can still expect maybe a sore arm and feeling a little achy, but some of those high fevers and those type of reactions appear to be less common in this group. The other thing that I know a lot of people are concerned about is the association with some inflammation around the heart that was seen, particularly in boys ages 12 to 29. They did not see any cases of heart inflammation in this study. But again, it was relatively small for such a rare potential complication. So good news, it was 91% effective and seemed to be very safe and even with fewer adverse reactions. We received word this morning that the Western States Scientific Advisory Group has also reviewed all of the data in detail, and they too have signed off and approved the use of this vaccine in our younger children ages 5 to 11. So all that we're waiting on now is for it to arrive here in Monterey County. We're waiting on the deliveries, and hopefully we'll see it being given out to children certainly in the next few days or the next week.
Thanks very much, Dr. Blum. Dr. Pudel, let's go to you and talk more about vaccine.
Thank you for the opportunity to be present in today's meeting. I think it's a really exciting time that we have vaccines authorized for our kids 5 to 11 that we've been waiting on for a long time. I think the question is, why do we need to vaccinate our children? Why is it important at this point? There are several reasons, because there's a significant population of kids 5 to 11 which are still susceptible to getting infected with this COVID-19. Although the severity of the infection may not be very, severe or bad, we know they're equally susceptible to be infected, and about half of those kids may be asymptomatic, and they still could transmit the infection to their parents and grandparents and other vulnerable adults around them. So I think this is a key step in terms of getting the pandemic under control, and also to give our kids chance to be kids, to let them do what they love to do. They can hang around with their friends, be around with their family members, and go to school with as little restriction as we can. So I think that's one of the major reasons. The other few important reasons that I really want to highlight also is these kids could have what we call a long haul syndrome, just like the adults can have. So I think it's important that we try and protect them from this long-term effect of COVID. And also there are several case reports of multisystem inflammatory syndrome in kids who have had COVID, which is a life-threatening condition and needs immediate attention. So I think because of these reasons, we really need to vaccinate those 5 to 11-year-old kids. And like Dr. Martha Blum mentioned earlier, those vaccines have been well vetted in clinical trials by several organizations, and they seem to be very safe and effective. So I think for any parents that has question or is hesitant about getting their kids vaccinated, me not speaking as a parent, but also as somebody who has seen this pandemic very closely, I think because it's so effective, so well vetted, has gone through a rigorous trials by several bodies, I can reassure to be confident in the vaccines for the parents.
Thank you very much, Dr. Pudell. I've got a question for both of you in the chat already, and I'll go ahead and ask it. Do you have doses for children on hand, and when would vaccinations begin? And I think you can each only speak for your own hospital.
Yeah, Montage Health and Community Hospital is not planning on doing any vaccine clinics for the pediatric doses. We do need to wait for that preparation to be delivered here in the county before we can start vaccinations, because it is a lower dose. Like I said, children in this age group get 1/3 the adult dose. It's coming in completely different looking vials so that it will be a separate pediatric preparation. So we'll all be anxiously awaiting its arrival. But again, Community Hospital is not going to be doing pediatric vaccine clinics.
Thank you. And Dr. Pudell, what about Salinas Valley?
So we haven't received the vaccine yet in hand, but we are working with one of our local clinics here in Salinas to make it available to the kids 5 and 11. So we're still working on the logistics with our staffing and other resources. And we hope to kickstart that hopefully in the near future, as probably as soon as next week. And we'll send those information out to the general public.
Thank you. I have another question for the both of you, or one of you. Now that the Western States Advisory Group has given its approval, are there any other panels that have to weigh in before shots can be given? It's been, for California, there's an extra layer, so they wonder, is there any more?
No, that was the final hurdle, was the Western States Scientific Committee. So we're done. We're good to go. As soon as we get it in hand and distribute it to all of the places that are going to be giving it out, we'll be good to go.
You know, I don't have any other question for you in chat, but I do have a question just kind of called from community interest. There still is a lot of concern, even though the vetting process about the vaccine has been thorough. Parents think they want to wait to see what happens. They're concerned about the initial side effects and then long-term side effects. And I know you've already talked about the vetting and you're already encouraging parents to go for it. What do you say to parents who are still a little hesitant?
Yeah, you know, I think as Dr. Blum, she touched on it very clearly early on. These side effects are very mild and short lasting. Most of the vaccine side effects, we would see them early on, especially within 2 weeks. And as you can see, there are thousands of kids who have undergone clinical trials and not a major side effects. I mean, I think that just speaks for itself. And also, if you look at the committee approval, it was unanimous, meaning it was 14-1. So this vaccine that has undergone such a heavy scrutiny with at multiple layers, and 100% of the experts saying that it is safe and effective in the kids, I think that just speaks for itself. So I would really feel comfortable and confident vaccinating my own kids. So I think based on those facts, you can be reassured.
Thank you both. Are there any other questions for both of our doctors before they go back to their regular jobs? I'm giving it a second here. I'm seeing none. Thank you both very much for being able to join us, especially kind of on a momentous day, you know, for California and Vaccine Youth. I appreciate you.
It's a very good day indeed.
All right, thank you both. And now we're going to turn to Dr. Ed Moreno, our public health officer from Monterey County, who is joining us. Dr. Moreno, do you have an update for us today, or are you available for questions?
Good morning. Good afternoon, Matt. No update, and I can take questions.
All right. I have questions that were submitted in advance. If anyone else has questions for Dr. Moreno that were not submitted in advance, go ahead and put them in the chat, and we will take those as soon as we're done with our first round. So let's get started. Dr. Moreno, does the state's data or the CDC's data on COVID-19 more accurately reflect the situation in Monterey County?
Excuse me, man. 1 second. Okay, ma'am, I'm sorry, I'm ready. What was the question?
Sure. Does the state's data or the CDC data on COVID-19 more accurately reflect the situation in Monterey County?
Ma'am, the information that we share and CDPH shares is based on data that's cases that are reported to us and laboratory results that are reported to us from laboratories that are testing for COVID-19, and we share that information with the state, and we post the data on our website. As far as the CDC's data, that's data that I think what people probably are looking at is the positivity rate and the case rate. And the CDC calculates a case rate on a weekly average with a 3-day lag. And there are differences between that data and the state, and the state's data. State data is a daily average over a week with a 7-day lag. So there will be differences. And I would say if anyone wants to look at the data, I suggest that they focus mostly on the trends rather than day to day, just to get an idea of where the case rates are headed and which direction the positivity rates are going.
Thank you, Dr. Moreno. Next question. Also, we've got several data questions, a series of data questions for you. Any ideas why there is such a discrepancy between the state data and CDC data? The CDC lists a case rate that is more than double what is shown on the state database. Yeah,
we don't know how the CDC calculates their case rate for Monterey County.
The next question, do these data issues indicate the county could actually have a higher case rate than what is listed on our county dashboard?
The case rates that you'll find on the CDPH website and our websites that we share publicly are estimates. And so I think the most important thing is for people to follow the trends over time, because that will give us an idea of how we're doing in terms of our efforts to slow the transmission of COVID-19.
All right, thank you. Next question. On Tuesday, the CDC said the case rate in Monterey County was 12.24, while Monterey County Health said it was 4.8, and CDPH said it was 5.1. If it had been up to you, would you have imposed an indoor mask mandate for Monterey County based on the CDC rate of 12.24?
I think right now, what people should know is that as the health officer, I still highly recommend that people wear face coverings in indoor settings. even if they're not vaccinated, so we can continue to on our efforts to try to decrease transmission. I think that's what people really should keep in mind.
Thank you. Next question. What is the plan for children ages 5 to 11 years of age for convening vaccinations for COVID-19 here in Monterey County?
Thank you. We have a number of vaccine providers that have been providing vaccines to individuals here in Monterey County ages 12 and up. And those individuals can request more vaccine by ordering vaccines for Pfizer vaccine for 5 to 11. So we do encourage our current vaccine providers to go ahead and put in orders to receive the new Pfizer vaccine for 5 to 11. In Monterey, I'm sorry, for public health, we just saw the Western states release with their recommendation for vaccinating children 5 to 11 with the Pfizer vaccine. And so our Public Health Bureau, based on that final recommendation, will be holding another one of our weekly COVID vaccine clinics. This one will be Saturday from 10 to 4 at the Bread Box in Salinas, and our staff will be providing, making available the Pfizer vaccine for children 5 to 11. And we will also continue to provide a vaccine at that clinic to everyone else 5 and up. We'll have the Pfizer vaccine, and we'll also have the Johnson & Johnson vaccine. And if someone wants to sign up their child 5 to 11, they can go to My Turn and go to that portal and look for an appointment. But we also will take walk-up. Thank you.
Okay, so, and thank you very much. I just want to emphasize that you're recommending people go to My Turn to make an appointment, but you will take walk-ins as vaccine is available?
Right, but that's just for the Public Health Bureau.
Right, and that's for this particular clinic on Saturday?
Correct. Mm-hmm.
Right, thank you. Another question, has the, answered a little bit of this, has the county received any doses, and how many more doses are you expecting in this first round?
We did receive our doses, and that's why we're announcing that we'll have the vaccine available for 5 to 11 on Saturday. Other providers are waiting for their vaccine to arrive, and I would suggest if someone can't make it to our clinic on Saturday, that they contact their local pharmacy or contact their healthcare provider to see if they've received the vaccine, if they can schedule their child to get the Pfizer vaccine.
All right, thank you. Continuing on with questions, how many children ages 5 to 11 years of age are eligible for the vaccine in Monterey County? How many are in that age group?
Oh, that's a good question. And I'll check with my team and get a response to you after this is over.
Okay, thank you. And another question, the COVID-19 case rate and test positivity rates are lower again this week than in previous weeks. The trend is downward, yet our community transmission is substantial according to the CDC and triggering the Board of Supervisors mask ordinance. Could you explain how that could be or can be?
Again, we in the CDPH provide estimates for case rates and positivity rates for Monterey County. The CDC has their own mechanism, which is a different methodology for calculating or estimating case rate and positivity rate. And as far as the mask order, I think I can't speak for the Board of Supervisors as far as their ordinance goes.
Thank you. And it looks like it might be our last question. How many doses of this pediatric vaccine does the county have?
What I do know is that in the pre-order process, vaccine providers in Monterey County were allocated 12,600 doses. That's countywide. That's a countywide allocation, and several of our vaccine providers, I'm told, did order that, so we were able to take advantage of our full allocation. What we're told is that what we're told is that by the state is that we should anticipate, or vaccine providers should anticipate having an opportunity to order additional vaccine on a weekly basis.
And sorry, let me confirm that number. The audio went down a little bit. The county received 12,600, but that was for all vaccinators, correct?
We have, I don't know that we received 12,600 vaccine. Our allocation countywide was 12,600. I don't have any verification that our vaccine providers have received their doses yet. All I know is that public health did receive ours, and that's why we're inviting parents to bring their 5 to 11-year-olds to our clinic this Saturday.
Can we say how many doses public health alone has?
I don't have that right now.
Okay.
I did get find out that there are an estimated 43,000 individuals from the ages of 5 to 11 in Monterey County.
Thank you. That 43,000, that answers the previous question about how many children are now eligible.
Correct.
That's all the questions that I have in chat for you. Are there any other questions for Dr. Moreno before we let him go? And I'm not seeing any. Thank you very much, Dr. Moreno, for joining us today and for answering these questions.
Okay, ma'am. Sure.
So moving on, we're very pleased to have Ashley Paulsworth, our Monterey County Sustainability Manager, with us today. She's going to talk a little bit about an upcoming workshop, a Climate Action Plan Community Workshop. Hi, Ashley.
Hi, Maya. Hi, everybody. Thanks so much for having me here today. I just wanted to make sure that I was sharing with this group that the county will be holding a virtual community workshop for the Climate Action Plan on Tuesday, November 16th. From 6 to 7:30. So coming to the workshop, it'll give community members a chance to learn about the greenhouse gas emissions inventory of Monterey County and the steps that the county could take to reduce our emissions by 40% by 2030. And members of the community will have a chance to share any of their climate-related concerns and talk about a future that they want in the county and tell us what they're already doing to be sustainable locally. And it's just going to be a great place to get involved in the county's process and share in the excitement around sustainability. And there's a lot of great policy and innovation being discussed at this week's COP26. We also have strong leadership at the federal level for climate action now. So I think there's a lot of opportunities coming down to us at the local level. And so the stakeholder process here is really important because it'll just give us a chance to really determine how some of these broader concepts and higher level policies and innovations could be implemented locally. So I just want to say, even if folks aren't fully invested in climate action, the Climate Action Plan has a lot of more broad objectives like green workforce development, building out sustainable infrastructure, protecting existing infrastructure, and improving prospects for youth and minorities, and even putting an end to traffic. So you can register on Eventbrite. There's also a link on the county sustainability page. We have a press release coming this afternoon and social media, and that will be putting links out on as well. At the meeting, we will make translation available. So when folks register, they can say, if they need translation into a different language, and we'll go ahead and provide that for the meeting. So we're really excited, and we hope we can get a lot of folks to come out and give us their feedback. Oh, Maya, you're muted.
Yeah, even my computer told me that. Thanks very much for sharing that. I know this really been long in the works, and can you talk a little bit more about, I know you've got a lot of speakers lined up, maybe share some of the topics that you're going to be covering. Yeah, so we'll be releasing the county's greenhouse gas emissions inventory. And so the inventory itself is broken out into emissions sources. And so there's about 6 different sources. So we'll talk about emissions that come from the agricultural sector. We'll talk about emissions that come from on-road transportation, emissions that are generated through building energy use, and the solid waste sector. And we'll also talk about any emissions that come from wastewater supply and treatment,
And then at the end of the meeting, during discussion and community engagement events, we'll talk about, strategies to decarbonize. And so some of the examples that I can think of are things like transportation-oriented development or land use policy. We'll talk about building decarbonization ordinances and opportunities, and electrification of transportation and our buildings. And that's the type of thing that you can expect to hear about if you come to our meeting.
That is a lot to cover.
Yeah.
It doesn't look like we have any questions for you, but I'm sure that people are going to be looking forward to it. And then for those who are interested, we'll be sending around the press release that has the link for a sign up, and we hope that everyone will get involved and will share it widely. Thanks very much, Ashley, for joining us.
Thanks.
And then last but not least, we are very pleased to have Cindy Burnham from Hitchcock Road Animal Shelter, or Animal Services, to talk a little bit about some trends that they are seeing at the shelter. It's a trend we don't like to see, which is an increase in strays, but also I'm hearing you need some foster families for your four-leggeds.
Yes, hi, thank you, Maya. I'm Cindy Burnham. I'm administrator at Animal Services, our Hitchcock Road Animal Services out on Hitchcock Road. And yeah, I wanted to just share that, over the months with COVID hit, we saw a really big decrease in animals over the shelter. In February, we had a total of 75 animals come into the shelter for both Salinas and Monterey County. And then our highest month we've been hitting was in August, where we had 375 animals coming into the shelter. So we've seen a big increase. And a lot of these animals have no ID. They don't have microchips. And so it's really, impacting our ability to try to place these animals or find them homes. And so we are trying to put out some information to the public to, as you continue to go back to work and go back to school, to make sure that your pets are safely kept in your homes, that they have ID on. And if you are looking, because we are starting to suspect that as people may have to move or find other places to live, that they're not able to take their current pets, that you don't wait till the last minute to do that, so that the shelter is your only option. There are resources out there to help people who may need to find another place for their pets temporarily, and we can help provide you those resources. But yeah, we've been getting a lot of dogs, a lot of large dogs, and large dogs can be very hard to place. It's a great thing to have a nice big, lab or a pit mix or even a husky, but those can be hard to just bring into your home. And so we have put out the call for a need for temporary foster homes to help us get some of these dogs out into the home environment where we can learn more about them, and hopefully the foster homes can help us place and find homes versus just sitting in a kennel here. So we definitely wanted to kind of put that plea out. Behind me, I've posted our texting program for people that either find or have lost a pet in Monterey County. They can text that program and it will provide links to our website, our local other shelters, tips and videos on how to find your lost pet. We've got a link to our lost pet report so that it's in our database. And then it continually sends you, I believe every 3 days, a reminder to go look on our website to see if your pet is here. And it actually also provides links to social media sites where people are posting about lost and found pets, because that's been a great resource. So just wanted to put all of that out there. We do have a lot of that information on our website at hitchcockroadanimals.org. And I'm available should anybody have any questions, or I've got some direct contacts for anybody that might be wanting to foster an animal for us for, 2, 4, maybe 6 weeks, and help us really with some of these individual dogs, help us get them into a forever home.
Cindy, I also understand you've got some hour changes that we should probably share with people.
Yes, thank you. We're having some staffing switches right now. And so we had been open from 10 to 12 in the morning and then again in the afternoon. However, we are having to reduce those. So the shelter will be open to the public Tuesday through Saturday from 1 to 5.
Thank you. And then I don't have any questions in chat for you, but I do have a question. I know there was a lot of national media attention about the pandemic where people emptied the shelters and adopted animals and now bringing them back. Is that the case? Are we seeing the case here, or is it really people having to move around that may be the problem?
We're not seeing pets that were adopted from or during the pandemic, and we're not seeing those. Those are all microchipped, and so that would be something to track. We're not seeing those pets. What we're seeing are new pets or new stray animals coming in with no owner. We do suspect some of them are from people that have lost their homes. Our officers are out talking to people, and so that's some of the feedback that we're getting. And we do suspect some are just being brought in as strays, but they're really owned, which kind of helps slow down the process of rehoming them. So we want people to tell us, what their situation is, but we are not seeing animals that we've placed during the pandemic coming back in droves. Those animals, we're hoping because people were home with them, they actually probably created an even stronger bond. And those animals are still in their homes.
Well, that's the upside.
Right.
Any questions for Cindy before we wrap everything up today? Seeing none, thank you very much, Cindy. And thanks everyone for joining us on the briefing today. Our next briefing is next Wednesday. We'll see you then.